Hello, dear viewers, and welcome to a new episode of DocTalk. Today, we're going to discuss anemia, one of the most common, worldwide widespread medical problems and diseases, often known as the hidden disease or the hidden epidemic. And today in DocTalk, we are joined by Dr. Fawzeya Alkhaldi, internal medicine clinical hematology consultant, Canadian and American board certified, to shed light on this medical problem or hidden epidemic, to know the causes, treatment, and also how to diagnose this disease, and also to know the possible treatments for future references. Join us right after this short break. Welcome back, dear viewers, after this short break, and welcome Dr. Fawzeya Alkhaldi in DocTalk.
Thank you very much for inviting me today to your show, which is one of the greatest show that I've seen myself.
Thank you, Dr. Fawzeya. And now let's jump into business. And my first question is, how can we define or give me a simple definition of anemia so we could understand it away from medical terms?
Sure. So anemia is basically the lack of blood, and we call it the hidden epidemic because it's really an epidemic. Everybody has it. It's like it affects a lot of people, but they don't know. So that's why it's called the hidden epidemic. And usually it refers to low blood. There's values for women and men and kids and adults. There's different values, but usually whenever the person has low blood, we call it anemia.
Okay, let's focus on the term hidden epidemic. Why it's called the hidden epidemic from your own point of view as a doctor. We know that it is widely spread here in Kuwait, but we're going to talk about internationally.
So an epidemic, as everybody knows after COVID-19, an epidemic is really widespread and everybody knows about it. But anemia specifically is hidden because nobody knows that. A lot of people don't know that they have anemia. They do have anemia. They're suffering from anemia. They go to different specialties thinking they have shortness of breath because they have a heart problem or a lung problem. They lose their hair. They think there's a problem in their hair, but the problem is really anemia. So it causes a lot of symptoms. People may suffer from them for years and years. And then when it comes to diagnosis, the root cause is the anemia. So that's why it's hidden. And unless you go to specific, to the right place, you will never be diagnosed with anemia.
Okay, let's talk about here in Kuwait and regionally in the GCC. We know that in recent years that there is widespread health awareness and everyone is taking care of themselves. And as you said, every disease is related or the root cause is anemia.
Yeah.
How is it is spread even though there is a wide focus and emphasis on general well-being, and yet we still have anemia or a vitamin D deficiency or other kind of deficiencies? Why, with all the healthy lifestyles that we are living, and yet we still have anemia?
Excellent question. So people relate to all the deficiencies in vitamins like vitamin D or anemia related to iron, which is the most important vitamin that causes anemia, with other vitamins like folic acid and B12. They think that poverty is the cause of the lack of these vitamins. And so anemia was thought of as poverty disease.
Okay.
But apparently both developed and developing and underdeveloped, even underdeveloped, they can have the same rates because the causes of anemia are not related to poverty. You can have a good lifestyle. Let's say you're an athletic and you're a female and you're eating healthy, but guess what? You're anemic. So how could that happen? Or children in Kuwait, a lot of children in the GCC, let's say, not just Kuwait, because they have good lifestyle, they have no poverty. How come our kids
still suffer from it?
50% of the kids, at least, let's say in the GCC, have anemia. And the reason is because we don't know the causes and we don't know what our kids need, the dietary needs in the kids. So our kids definitely will suffer from anemia, vitamin D, B12, folic acid. They go together. So it's a part of the disease of anemia is related to dietary problems. The other part is related to what's going on in the GCC. So basically, We have a lot of people, a lot of females at least, they're suffering from bleeding every month with their menstrual period, but they don't know about it and they think it's normal.
Yes.
So they normalize it among all the family members, among all the society, and they think this is normal, which apparently is not normal. 50% of the females are suffering from anemia versus 50% of the females are not suffering. A lot of the mothers suffer from anemia because they're lactating and they're giving birth. So, and some of them have cesarean sections. So from the age of menarche until the age of, let's say, postmenopausal, 50% of the females will suffer from anemia. This is one population. Now we go to the second major population are the kids. Yes. So school kids, most of them, the toddlers, because they're still getting good diet at home, they don't suffer from anemia. But most of the, let's say, 4 to 10 years old will suffer from anemia because their diet is not optimum. A lot of kids survive on fast food. They drink a lot of milk, and that will prevent, so they take a lot of milk and milk related products, so they cannot really absorb iron from their normal diet. Going to the third population, the third commonest population in Kuwait will be the elderly. So a lot of elderly, we call them, in the medical terms, we call them bread and biscuit. So they only, tea and biscuit, sorry. So they just drink tea and biscuit and they lack interest in food. And you can see it among elderly population. Yes. So these population, no one take care of looking for anemia because they have more health problems like diabetes or hypertension, heart disease. But unless you fix their anemia, their other problems will not be fixed. Because think of it, the anemia is related to the blood, lack of blood. And your blood goes through the whole body. It provides every single organ with nutrition, oxygen, so that organ would work. So unless you have enough blood, it's like, I think of it, I always explain to my students and my patients, think of it as your gasoline for your car. Yes. Unless you have gasoline, the car will stop working, even if every single part of the car is functioning well. So unless you have good blood flowing in your organs, every single organ will suffer. Okay. You said that blood is like the fuel of the body. Yes. Okay. What happens if there is too much blood? Or I don't know the medical term, but let's say. Yes. Hyperviscosity. Yes. So it's the opposite. So everything, if you look at the human body, everything has to work in the neutral position. Yes. If you have more or less, you're going to suffer from problems. Yes. So if you have a lot of blood, you have hyperviscosity, and it's hard for that blood to run through your veins. It's like water running in the pipes. And then if it's too much viscosity and the blood is stagnant and flowing so poorly, then first of all, your organs will suffer because you're not delivering the nutrient and oxygen as fast as needed. Yes. And then number two, because of the stagnation and the blood is so thick, it will cause thrombosis or clots. So the opposite of anemia is thrombosis. But thrombosis, we'll talk about it in the next, inshallah, episode. But usually anemia is more common, more common. And it, as I explained to you, affects everybody from beyond toddler age to the senior age. So it affects, that's why it's called an epidemic, because everybody has it, everybody suffer from it, but nobody knows that they have it. Okay, and what if the anemia is not treated? What it could develop any other risks? Yes. Yeah. So let's start with the short-term risks and then long-term. Yeah, this is what I was about to talk about, the temporary anemia, as they call it, or the lasting anemia. Yes. Yeah. So in medical terms, we say temporary or acute, and then the long-term is chronic. So the problem with anemia, when you have an acute anemia, let's say, you may have pale skin, looking unrefreshed, even if you slept hours and hours. You can't wake up from sleep. And if you wake up, you'll tell everybody that you felt that you never slept. Yes. Even you slept 12 hours. So unrefreshing sleep. pale skin, hair loss. You can have some abnormal cracked skin in your lips or your face. Sometimes you have abnormal nails. Your nails will break very easy. Yeah. And you may gain weight even though you're not eating as much. That's one of the signs that, or the complaints the patient come with. Now this is the, and then you cannot, you have palpitation or high heart rate. Your heart will pump very fast when you do simple activity, just because it needs a lot of blood, so it will pump so fast. So the patient may have fainting attack and may go to the cardiologist thinking that their heart has a problem.
Yes. So Dr. Fawzeya, I would like to keep talking about the symptoms, or let's say the signs of anemia, but we need to look into that short report and we'll come back to discuss. So please stay tuned and enjoy the short report. Welcome back, dear viewers, after this health and wellness report. And now we continue with our dear and lovely guest, Dr. Fawzeya Alkhaldi, about the signs and the symptoms of anemia. You said there is temporary and there is chronic anemia.
Yeah.
So is there different signs for each one of them, or they all share the same signs?
No, it's probably, they start as simple and then they become more aggressive.
Yes.
Or more serious.
Okay.
And we started explaining before the report about the physical signs. I'll just sum them up. So if we'd like to just wrap them up, it's going to be basically your color. You have no, like you look like dead basically.
Yeah.
And there's degrees. So you may look like yellow, pale, and then completely pale.
Yeah.
Some people look even dusky.
Yes.
And then your hair loss, your nail breakage, gaining weight, your heart beats so much. You can't, a lot of patients complain that they can hear their heartbeats.
Yeah.
You're short of breath, even with simple exertion. Your quality of sleep is so poor. And then we go to the psychological signs or symptoms. So you're depressed, easy irritability. You have what's called brain fog. So suddenly you want to say something or want to remember a name, or you.
Yes.
So the memory gets really distorted. In my years,
we get blur vision.
Yes, we get blur vision. We have picas. Picas means you would love, like you would love to eat something that is really non-edible. So a lot of people complain they eat a lot of ice. They crush it and eat it. So sometimes they even drink the cold coffee, not because of the coffee. They want to crush that ice. They have this feeling. Some of people eat weird stuff. So like tissue, they love to eat the grass or
the sand
after the rain. Yes. So this is all signs of anemia. Once we treat them, this is gone.
So it's a sign of anemia. So it's not about something I want or desire to eat.
No, abnormal desires to eat something that's not edible.
Yes.
And with time, that thing that you eat will harm you.
Yes.
So it has to be treated. So you stop that. Some people, they even scratch the walls and they eat that dust.
Yeah, the dust or the bricks. There are some people who like to mud.
So the mud, so really that's not edible and it's harmful to your body and you have to get rid of it. But as soon as you fix your anemia, you're going to get rid of these symptoms. Now, one of the major chronic things, you can have heart problem, kidney problem, every organ will be distorted. And with elderly, in my senior years, in my senior project, we did a study about anemia related to falls in elderly.
Yes.
Falling is the beginning of the end to elderly. Once an elderly person falls down, they could have bleeding intracerebral, they could have fractures, and they could be fully independent before that fall. And guess what? Suddenly they'll be fully dependent, bedridden.
Fragile as
because they're very fragile. So anemia should be taken care very well in elderly population because they would suffer more than young population. And one of the other population that I've seen in Kuwait are the post weight loss surgery and people on medication, weight loss medication. They usually, and it's a because obesity is an epidemic in Kuwait. Also, these modifications are epidemic in Kuwait. A lot of these people suffer from anemia, and guess what? None of them knows they would do the surgery or take the medication, the weight loss medication for years, and suddenly they either going to collapse, have a fracture or fall down or something, and they think they're miserable in their life. And guess what? Everything behind this, they may even taken depression medication.
Yes.
And the only problem they had, the root cause was anemia. Fix that anemia, everything else will be easy to be fixed.
Yes. Okay. We talked about the symptoms. Now let's talk about the most common causes of anemia.
Yeah.
You said there are, let's say, clinical or physical causes, and there are psychological causes. But here in Kuwait, let's talk about the major causes.
So the major cause, honestly, is number one, dietary causes, because even though we are we have no poverty in Kuwait, still the people. The concept of eating outside or fast food has been incorporated in daily life with families.
Even though we see the widespread of healthy or clean restaurants, yet we still
unless you prepare your own food, you're not 100% not sure of the nutrient.
Yeah.
So if you're 70% eating at home and 30%, that's fine. But a lot of people have reverted that percentage, and they probably 80% eating from pre-made food, whatever the source is. Even when they're trying to be healthy, they go into pre-made meals.
Yeah.
And a lot of people also don't eat meat, red meat. When I say meat, I mean red meat. A lot of people in Kuwait would
go to the chicken.
Mostly chicken. And so red meat is your only source of, I call it the rich iron.
Yes.
So the iron is the main vitamin that we need to build up our blood, plus vitamin B12 and folic acid. They're all provided in red meat. If you eat a small piece, like your palm of the hand, that would give you iron for, like, if you take tablets for, let's say, 1 month.
Yeah.
But unfortunately, people don't prefer to eat meat for whatever reason. And despite that, our grandparents, they used to live on meat.
Yes.
And the chicken was not introduced until later because in their culture. But now, most of the people rely on chicken and find it more edible.
Or salmon,
they made it more edible. But the meat is the
main source,
100% source. And even people who try to make you think that iron is available in green stuff or available, yes, green stuff, let's drink a green drink or something, or whatever they promote. Still, the meat is the rich source of iron. And I would like you to promote that through your program, that meat, although the meat, we tell some patients don't eat it because of high cholesterol, try to go for the lean meat. Don't devote the kids or the people who doesn't have problems, like the young boys and girls, from eating the red meat, because this is going to be the source of their iron. Give them red meat twice a week from your own home, and try to promote that idea, because we need it.
See, the moment we graduate and start working, it's the same moment that, let's say, I don't want to say our mothers, but let's say our homes stop cooking.
Yes.
When we used to be in high school or school, we come back, we find lunch, whether it's meat or chicken, or there was a healthy meal,
hot meal on the table,
waiting for us.
Yes.
We leave our house eating healthy, we go back for eating healthy. And now, even though, as I said, there's a highly promoted healthy and clean eating in Kuwait, and yet we still have anemia and obesity. So it's not a win-win situation, it's a loss-loss situation.
Yeah.
So you said dietary causes. What are other causes?
So the other second causes are these surgeries, the weight loss surgeries and medication, although they are an excellent innovation in keeping people healthy.
Yes.
And maintaining their weight and getting rid of, if you measure the risk of obesity versus the risk of anemia, the risk of obesity is definitely a deadly cause. But I would still think that once you go to take a step into losing your weight, make sure you check your blood at least once a month. Make sure your iron and not just your blood, your iron. So we refer to it as the storage of iron, which is called ferritin. I usually check it with patients who have done weight loss surgeries or weight loss medication on every month or every 2 months. And if it's a female, every 3 months would be the optimum time to check it and make sure that's optimum and replaced. Whether to replace it depending on your situation with diet. Some people who have done surgeries or some people have poor absorption, they need to take tablets or need to take IV iron, but definitely don't let yourself suffer because of that. Now, the third cause of anemia in Kuwait or in the Gulf population is congenital anemias like thalassemia, sickle cell anemia, and other hemolytic anemias. Because of the high consanguinity in the Gulf area, a lot of people marry from their own families, and they kind of like they have these genes running in the family. And we didn't have, before the premarital examination, we had a lot of congenital anemias in the Gulf area. And thank God we implemented the premarital examination and they started to work on that. Yes, they limited so much. They give you the option that this marriage is not safe. And then if you decided to go ahead with that marriage, and they tell you that you're definitely going to have a sick child who's going to be anemic for the rest of their life and they need blood transfusion. Speaking about blood transfusion, it's not the solution in every anemia. And as a hematology consultant, I assure everybody that treating your anemia ahead of time with many modification is 100% safer than taking blood. A lot of people nowadays, they go for, let's say they lost weight and they're going to go for surgeries, plastic surgeries, which is not a critical surgery, an emergency surgery. And they would say, okay, well, what if I have anemia? Just give me blood and do the surgery. But I can assure you that giving blood, even with the safest, we have the best blood bank in the whole region, and we have the safest machines that check the blood, even though there's a lot of complications for blood transfusion. And
I'm sorry, Dr. Fawzeya, we need to take this short break, and then we're going to keep talking about the anemia and everything. So please stay tuned. Welcome back, dear viewers, after this short break. And now we're going to start one of my favorite segments, Myth or Fact, with Dr. Fawzeya Alkhaldi. So, myth number 1. The only cause of anemia is iron deficiency.
False.
Okay. What are other causes?
So as we explained, you can have congenital problems, you can have surgery problems, you can have absorption problems, or loss problems. So mainly if you have, let's say, cancer, that's going to be one of the main reasons that we see in elderly, and it can cause, if you have a kidney failure, you can have anemia. So definitely not the only cause.
Okay. Myth number 2, anemia can be cured just by eating spinach.
False. Popeye the Sailor Man. No, that's actually not true. I would say spinach would be the least diet you want to be on if you want to lose weight. And I know Popeye, we lived on Popeye the Sailor Man when we were kids, and that's not true. We can't absorb iron from plant-based iron so easy. So we have to add vitamin C, and we have to consume a big amount of plants to get what we can get in a small piece of meat. So.
Okay. Myth number 3, and this word is a little bit difficult for me. Anemia is contagious?
Contagious?
Contagious.
Definitely not.
Okay.
No.
It's not contagious.
You cannot get anemia because you sat down with an anemic person.
Okay.
So HIV could be contagious, hepatitis C, a lot of transmitted
So it's not bacterial or...
it's not transmitted, it's not contagious.
Okay. Myth number 4, anemia only affects women.
False, but definitely women suffer more. They get the win-win situation when it comes to anemia because of the way they were born. They have their monthly menstrual period, they have birth, they give birth to kids, and they lactate. So definitely they suffer more, but men, let's say if I have a clinic and I have 10 patients, I would diagnose 9 girls and 1 man, or 9 women and 1 man.
Okay.
Per clinic.
Okay. Taking vitamins always prevent anemia. True or false?
False.
Okay.
So vitamins can maintain your needed vitamins per day. But if you have a source, let's say you're bleeding, whether you have a GI bleed, whether you have any other source of bleeding that you're not aware of, even if you take vitamins, the supplement, they will not prevent your anemia.
Okay, my final myth or fact: if you don't look pale, you cannot have anemia.
I think this one is a fact. Most of the anemic patients, they would look pale, definitely. And if it's a woman, she will hide it with putting more blush and makeup. And a lot of women will say to you, a few years ago, I never used blush or even lipstick. And nowadays, I cannot see myself in the mirror without a blush. But she doesn't. This is the sign of anemia. So definitely every anemic person would look pale.
Well, these are my myths for today. And we're going to take a break and jump into the final segment of today. So please stay tuned. Welcome back, my dear viewers. And unfortunately, we reached the end of our show or episode today. And we would like to ask Dr. Fawzeya for our final advice for you, to our dear guests, to maintain a healthy, let's say, blood.
Healthy blood. I love that word. Okay, so basically, I'm all for the awareness of preventing anemia ever since I got this specialty. And I would advise, first of all, the mothers, because you're the key point in the house diet and the family diet. So maintain your family diet. Make sure you have red meat on the table twice a week. Make sure that your kids stay away from a lot of let's say non-healthy foods, because they prevent the absorption of iron and other vitamins. So if your kids live on non-healthy food, any diet with a lot of caffeine would prevent your kids from absorption iron from their normal diet intake. Number 3, if you have girls from menarche until the age of, let's say, menopause, make sure these girls are being checked for anemia because they're at risk.
Okay. Dr. Fawzeya, thank you very much for joining us on DocTalk, and we hope that in our next episode that we will get more information about blood diseases.
Thank you.
It's our pleasure. So, my dear viewers, also thank you for joining us, and until next time, enjoy your day.